Okay, so thank you for joining us. My name is Alec Hall. This is the 10th module, mental health diagnoses, community and school settings of the Birch Project's 10 training modules in supporting youth in schools and in the community, trainings for paraprofessionals and mentors. So before beginning with our content, I would like to introduce the Birch Project to those of you joining us for the first time for this module series. The Birch Project is the Behavioral Health Integrated Resources for Children's Project. Its mission is to provide professional development and resources for schools, as well as to strengthen coordination of behavioral health supports across school and community agencies. The Birch Project is led by faculty members from the University of Massachusetts, Boston, and Amherst, and is sponsored by Boston Children's Hospital. For more information, please check out our website at umb.edu/Birch. For introductions, once again, my name is Alec Hall. And as you can see, we have the supported authors as well, who's also contributed to creating this module from the Birch team. I'm a second-year doctoral student studying school psychology at the University of Massachusetts, Boston. I am from Coney Island, Brooklyn, New York, so please pardon my accent. I have been working with the Birch Project for the past year so far. So the Birch team would like to extend a huge thank you to the paraprofessionals and mentors who made these modules possible. They provided us with critical insights into the work they do, which was greatly helped us develop the module you are about to view. So here is the agenda of the topics we will discuss during this module. So topic number one, processes for diagnosing. Topic two, overlap between trauma and ADHD. And topic three, DSM and DESE differences. So as it is important to learn about the information in this module, we would like to, catch you up and review key points from the previous module, career paths and certifications. So here were the takeaways. Paras or paraprofessionals are critical to the behavioral and social emotional development of youth and adolescents. Paraprofessionals and mentors are equipped with the skills to excel in multiple career paths. And lastly, considering how do we adjust the barriers and challenges to retaining these positions, such as paraprofessionals and therapeutic mentors, or mentors in general. So moving along, we would like to begin with 3 learning objectives that we would like you to walk away with today from this module. So learning objective number 1 is to demonstrate knowledge of some common mental health symptoms and diagnoses, demonstrate emerging understanding of the overlap between trauma and ADHD symptoms, develop knowledge of the differences between DSM-5 diagnoses and DESE educational categories. All right, so many may be unfamiliar with the process of diagnosing mental health disorders in the community settings or identifying educational disabilities in school settings. So this topic will help address what goes into this process. So who does what? In the community, psychiatrists, psychologists, psychiatric nurse practitioners, or any outpatient or family therapist, such as a licensed mental health counselor, licensed clinical social worker, licensed independent clinical social worker, licensed professional counselor, or licensed psychologist, are mostly responsible for giving a student or our youth a mental health diagnosis from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, commonly known as the DSM-5, which we will talk about later in the module. In a school setting, the IEP team, which consists of a team of service providers in the school, such as a school psychologist, school social worker, school counselor, special education teacher or special education coordinator, general education teacher, and other stakeholders, including families, occupational therapists, speech therapists, and physical therapists, pretty much are involved in these in the process of identifying these disorders or educational disabilities that students may have. So these education disability categories were outlined by the Individuals with Disabilities Act of 1975. So here I will address common misconceptions of mental health diagnoses. So here are some myths that mental health conditions are uncommon. Mental illness is caused by personal weakness. Different races are more prone to mental illness than others. All depressed individuals are suicidal. Some stereotypes. People or children who have mental health diagnoses may be stereotypically violent or incurable or weak, which is not the case. Certain biases that mental illness equates to crazy. Going back to the racial aspect of it, that Black people are more prone to diagnoses such as oppositional defiant disorder, or that there's no such thing as mental illness. So Kessler et al. Shares that more than 50% of people will be diagnosed with a mental illness or disorder at some point in their lifetime. So here we will highlight common mental health diagnoses or experiences in different periods in one's lifetime. So as you can see, during child and adolescence, a good amount of folks can be diagnosed with attention deficit hyperactivity disorder, also known as ADHD, autism spectrum disorder, eating disorders as an adolescent, anxiety disorders, adjustment disorder, oppositional defiant disorder, post-traumatic stress disorder, also known as PTSD, obsessive compulsive disorder, also known as OCD. Some diagnoses that may be diagnosed in adulthood, such as major depressive disorder, bipolar and other mood disorders, PTSD, personality disorders, schizophrenia, or conduct disorder, which meets criteria for late adolescence or early adulthood. So here we will revisit trauma that we introduced in earlier modules, and also review some symptoms of ADHD, as well as these diagnoses can be misconstrued for one another. All right, so what is a traumatic event? So according to the National Child Traumatic Stress Network, a national event is a traumatic event, is a frightening, dangerous, or violent event that possesses a threat to a child's life or bodily integrity. Witnessing a traumatic event that threatens Life or physical security of a loved one can also be traumatic, and also known as a form of vicarious trauma. So these things, traumatic events can be child abuse or neglect, witnessing or experiencing domestic violence, sexual assault or abuse, experiencing grief or loss, divorce or witnessing a divorce, having an accident, an injury, an illness, or bullying. Not everyone who experiences or witnesses a traumatic event experience traumatic stress in response to the event. Protective factors can buffer against traumatic stress. Protective factors such as, having the access to the right mental health care, the right family support. However, risk factors can exacerbate likelihood of these, of experiencing the negative impact of traumatic stress. So what is attention deficit hyperactive disorder, also known as ADHD? ADHD is defined by an ongoing pattern of inattention or hyperactivity impulsivity that interferes with functioning or development. So you have the inattentive type, which can be off task, lacks persistence, difficulty keeping focus, or being disorganized. There's a hyperactive type, constantly moving around, especially in situations where it is not quite so appropriate, excessive fidgeting or talking. The impulsive type acts without thinking first, has a desire for immediate gratification, sometimes socially intrusive, does not consider long-term consequences. So, where is the overlap between ADHD and trauma? So things such as hypervigilance can be mistaken for hyperactivity. Dissociation can be mistaken for daydreaming. Responses to trauma can be mistaken for aggression and impulsivity. So it's just very important to be aware of the symptoms between the two and how they overlap. So, as mentioned before, we will be heading into the differences between DSM-5 diagnoses and DESE educational disability categories. So as mentioned before, the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is used to diagnose mental health disorders. So pretty much the DSM-5 is pretty much broken down by the following categories: neurodevelopmental disorders, psychotic disorders, mood disorders, anxiety disorders, dissociative disorders, somatic disorders, eating disorders, sleep disorders, impulse control disorders. So, as I mentioned before, diagnoses are given by licensed mental health professionals who work in the community, being folks who work outside of the school systems. All right, so going into the school system. So the Massachusetts Department of Elementary and Secondary Disability, also known as DESE, categories follow very closely to the IDEA, or the Individuals with Disabilities Education Act of 1975. So the Massachusetts Department of Elementary and Secondary Education disability categories are divided into the following: autism, developmental delay, communication impairment, emotional impairment, health impairment, intellectual impairment, neurological impairment, physical impairment, sensory impairment, or specific learning disability. Eligibility decisions can be made about whether a student meets criteria for an educational disability category, which is made by IEP teams. So eligibility for special education services is based rather on an educational determination of a disability, which includes not just meeting the criteria for a specific disability, such as autism, but also finding that a student is in need of specially designed instruction to be able to make progress at school. Students who have received a mental health diagnosis from a licensed mental health professional in the community may not necessarily qualify for special education services. So it's important to understand the differences between a clinical diagnosis in the community and an educational determination of eligibility for special education services in the school can help parents and providers become better advocates for their children and for youth. So here we will use a case study. So this case study is about Laquan, who is a 7-year-old boy in the 2nd grade. So pretty much if you are a paraprofessional or a mentor, you were made aware of his medical or clinical diagnosis provided by an outside psychologist of autism spectrum disorder. However, Laquan was evaluated for special education 2 years ago, and he did not meet criteria for an educational disability category of autism. You were made aware of this in the beginning of the school year. It is now February, and you feel his behaviors are impacting his academic performance. So what would be your next steps to help Laquan? Now, just give you a couple of seconds to really just think about it or process it. So, I mean, now that you've thought about it, we'd also, offer possibly just starting off by sharing your concerns with team members or the teacher you're working with or the clinical supervisor you're working with. And just learn more about, Laquan's history and his current skills. So we would recommend that just being a start to helping Laquan out. So these are also things to think about. Considering the impact of culture and trauma, we suggest that you use the following questions to guide your work with youth and your practice. How can you tailor your practices to the population you are serving? How are you making sure what you're doing is relevant to the student or your client? How are you checking your own biases? Are you critically thinking about the decisions you're making? So now that we have reached the conclusion of our module, we would like to summarize some things that we've learned in this module. So we would like to leave you with some takeaways. So takeaway number 1, there are distinct differences between educational disability categories and DSM-5 mental health diagnoses or disorders. Special education disability eligibility is determined by DESE criteria and not the DSM-5. There are a number of myths, stereotypes, and biases associated with mental health difficulties. So awareness of these biases is the first step to eliminating their negative impact. Trauma responses are often confused for symptoms reflective of other diagnoses such as ADHD. So trauma-informed practice is very important to better support our students. So, just to conclude, here are some more resources. Here are our references. So yes, thank you for reviewing this module to learn about supporting students and youth as a paraprofessional and mentor. We would like to thank you for your time and attention to the behavioral health needs of our students and our youth. At our website, www.umb.edu/Birch, you can sign up for a subscription to get more information on best practices such as supporting youth. We would love to hear from you. So please reach out to us with thoughts or questions. We hope you view the rest of our modules as you are, building your capacity to support students with intensive behavioral health needs. Once again, my name is Alec, and thank you.